My name is Dr. Lara Hart. My role is pediatric gastroenterologist, and I've been at Humber for 6-ish years so far. So as a pediatric gastroenterologist at Humber, I've got 2 full days of clinic where I see pediatric patients anywhere from ages 0 to 18 with any type of GI conditions, from stomach ache, reflux, constipation, to eosinophilic esophagitis, Crohn's, colitis, and celiac disease. And then aside from the clinical duties, I also have the opportunity to do endoscopy here 2 to 3 times a month, which is amazing. We've got such a great setup for endoscopy here. And I also have patients that can be admitted to hospital for inpatient care if they have a disease flare of their IBD, for example. I was raised with both parents being physicians, and my dad actually tried to talk me out of becoming a doctor, so as a teenager I rebelled and went into medicine, but I've always wanted to help patients, help children feel better, and so it was a logical move to become a doctor, and particularly to become a doctor for children. I enjoy so many aspects of it, but in particular it's just really amazing to actually be able to diagnose the child's condition and provide them with treatment options to get them better. And they come in feeling so unwell from so many different manifestations of their disease. So in particular, my area of interest is pediatric Crohn's and colitis. They come in with significant weight loss, abdominal pain, waking from sleep with their pain, diarrhea, symptoms they can't really talk to their friends about, low energy, low appetite. And after we're able to diagnose their disease, we're actually able to, as gastroenterologist, I'm able to actually help them get better, be able to get their disease in remission with amazing medications we have. I focus on the holistic approach to the patient, so we're not just looking at their gut, but we want to look at their quality of life, helping them cope with their disease, providing them with education around the disease, giving them basically empowering them to feel that they're able to manage this situation because it's a chronic disease. So being able to see them from when they're so unwell to feeling so much better to growing well is very rewarding. Humber has been amazing in regards to infrastructure that allows me to grow and develop my GI clinic. So when I first started here, I had a general GI clinic, and I was able to thereafter develop a multidisciplinary inflammatory bowel disease clinic for kids with Crohn's and colitis. So at this point we have, again, a very holistic approach to the care of the children with IBD. We've got a nurse practitioner in the clinic, myself, dietitian support. We're working with our mental health colleagues to help children with anxiety and depression related to their IBD. We have an amazing team in endoscopy. The nurses there are, amazing at their job and helping with children. We've got an amazing nursing team on the ward, so I can do admissions for patients. So ultimately, Humber has the most amazing infrastructure to allow me to have built my GI clinic into a focus on IBD with a very much a holistic approach to helping children, and a unique IBD program that we have at Humber that we wouldn't find in other places. The pediatric program in general is just such a warm and friendly atmosphere, and all of our patients tell us that they have such a great experience here. I've had patients who have been on the ward for up to a week, and they find the nurses so helpful, and the entire team up there, all the allied health being really helpful for their care. In general, all the pediatricians are very warm and wonderful and caring for the kids, so it's really nice to be part of that team.